Hello and welcome to idea. Hello and welcome to Ideas with Diana. For this December 18th, 2020. Before I start on my two main topics, I'd like to wish everyone Merry Christmas and Christmas greetings from the United States. So far, basically, we are still concerned about this COVID virus, and in my local community, we're trying our best to follow through with the guidelines issued by the governor and by other people. Although for many small businesses around here, we're wondering how many of them are going to make it past the new year because it has been hard, because the only way businesses can survive is by drive-through or basically, and if those trying to do takeout, for many people here, many people walk to the grocery store and doing takeout. It's a little bit extra to the walk, as many of them are about my age, close to 60 or older with a health condition. With me, it's a heart and nerves. I have a combination of both. My heart and nerves are out of sync, so it's not just to have a simple pacemaker. But getting on to the two topics of the Brexit impasse and the virus. Yesterday, I was watching DW News, and I wanted to see about the virus impasse and Brexit, and they showed a photo op of where Boris Johnson, the Prime Minister of England, and the EU President, the Prime Minister of Denmark, tried to meet. At one point, they came, and someone stepped back, and it's like almost like ready to pull out like a lure, and they go, no, we got to stay between these two lures, and it's like the Saturday Night Live skit, basically it showed a caricature of Biden pulling out a yardstick and going with a tape measure to make sure that everyone was just, regarding the Brexit impasse, the thing is, regarding the tape measure, that's not what people are concerned about. People are not concerned about that. What people are concerned about, let me go bring two pops for you, just a minute. What people are concerned about is the movement of goods and services, fresh milk, fresh food, and also medicine. Like this is a diabetic pen for those of us who have diabetes. I take 2 shots a day due to it, as I have type 2 diabetes. Due to one time having medicine that made me balloon up to 400 pounds because the insurance company wouldn't pay for the proper medicine to help me after my dad died. So they gave me a generic, and I'm coming back down again. I'm about 290, but I still have to take this. But with the Brexit impasse, really, I understand you guys have a lot to talk about, fishing rights and all this stuff, and some other, excuse me, some of this other stuff. But here's what we did in Wisconsin. This year in Wisconsin, what happened was the time for Real ID, and Real ID is basically means that when you have your driver's license, you have a special type of driver's license that's basically that's linked to your address in your birth certificate. And so basically it's almost like a passport, but it's like a passport level 2 thing. Well, what Wisconsin realized, and this is of both sides of the House, Republicans and Democrats, both of them mutually realized this. With the pandemic going on, there was no way that we're going to meet the October 2020 deadline. So what did they do? Rather than land how about this or take about the 6-foot stick and figure out whether we're 6 foot apart, they said, look, okay, well, we haven't resolved the pandemic yet, so okay, let's make the Real ID deadline November of 2021. And when I called up, I was greatly surprised, as was others, because actually this was someone thought for a change, and this was an example of good government. The reason why I bring up this analogy to friends across the pond, I understand you have your ways of doing things different from us in the United States, and it's like one person said, two countries separated by a common language or something like that. Yes, I understand you have your ways, but for the good of your people, and also especially this time about getting vaccine and services, why don't you just set a date 1 year from now, to set a deadline, because basically with the vaccines developed, if everything works with the vaccine and people are treated, and we can get this thing under control by March, by the time December 2021 comes, there should be enough time for everyone to meet and not have to do this virtual thing, or virtual tag, as I call it, as a new version of phone tag. Well, I'm not in. You're it. I'm not in. Whoops, I gotta go. I have a family thing to do. No, we can all get together and meet and talk in a place of business where we can talk in business and not be interrupted by other things. And that's what I'm saying. For those who work on Brexit, I'm just throwing something out there. It's my humble opinion. And I understand, you guys have your ways of doing things, and other than what we do in the United States, and and stuff like that, though. And I'm not asking you to become Americans, or basically copy the way we think or something. I'm just saying this just as an idea. Since the pandemic's still going on, and it's hard for people to meet, and you have all this virtual things, and sometimes you don't have the virtual things working right. Why don't you just set a new deadline of December 21st? I know there's going to be a lot of moaning and gnashing and gnashing of teeth, according to some of the media that's over there, and in some of the talk shows and talking heads. Well, that's part of leadership. You have to take sometimes that the ball goes in the rough and you get in a sand trap, or sometimes you get stuck behind a tree. Professional golfers do all the time, get stuck behind a tree. I just been like, get one more prop. As pick up one more prop, get stuck behind the tree. You pick up a 7-iron, and or you decide a tree, pick up a 7-iron, and just try to pitch it as close as back onto the fairway to get the plan for next shot. Or like what I used to do, which I'm going to do this next year, is one of my goals, is buy a left-handed 7-iron, because I can actually play golf both ways. But I kept a left-handed 7-iron bag just in case, if I ended on the right side of a tree, I still could do a partial swing to move it forward. And that's what you got to do with extending this Brexit to November 21st. Take out the 7-iron, and get that done. And I think what happens, I think a lot of people will be grateful that you did that, because the thing is, many people who are during this pandemic are really working on very thin resources and family budgets, and they can't afford to have delays of food, of fresh food products, medical, just because basically that someone at the Port of Calais or someone at the Port of Dover is trying to do the job, and they're in a position where they have to do the job, because if they don't follow through with the rules, they'll be fired and have a hard time finding a second one. So basically, and it's also the time that basically you really need to have goods and services flowing. So like, if Germany makes this vaccine and is able to lamp it up to give it to make it for the whole European Union, or Russia's able to come through with their vaccine, you got to make, or even Pfizer's able to basically get it over to Europe too. You got to make it so that things flow, because when you have vaccine waiting a truck at a border crossing, it's like each time the truck waits, basically that inside truck gets hotter, hotter, because a lot of these trucks are made of Tyvek, used to be the thing they used to use for floppy disk covers, but it's a covering now that they use on trucks like FedEx and UPS and all that stuff. So what happens? Those things get warmer and warmer and warmer. The more they sit on other trucks, waiting, and it's very easy. Just administratively, just tell your member countries, look, due to the pandemic, we're going to extend this Brexit final thing until December 21st. Of course, you're going to have a lot of moaning, nodding, and gnashing of teeth, and but that's part of leadership. I mean, if you want to be Mr. or Mrs. Popularity all the time, don't go into politics or don't go into leadership. So I mean, and I'm sure everyone involved in the European Union and in the UK knows this. I mean, basically, it's like it's part of the thing you learn in school, part of the thing you learn at university, and that. So, just my thought. The second thought is basically about the virus deliveries, about the virus now. Well, in the United States, the Pfizer virus has started to get delivered to different parts of the country, like the Midwest. One local hospital here has started inoculate hospital staff. However, for most of the Midwest, we're told we're not going to get it until March, and so basically most of us are following the guidelines as best as possible, staying in as much as possible, avoiding public crowds. When we do go out, we sit apart, but we don't pull out the yardstick and measure for exactly 6 feet apart. We're not that like that though. And also the thing is, it's just basically the other thing about the vaccine is there have been cases, about one case where one vaccine, a few packages arrived, they were so cold they were unusable. And another thing is basically a lot of places in the U.S. still don't have what they these super cold refrigerators that go down to minus 70. So I guess that's the term. That's degree temperatures minus 70, not minus 95. All right. So, but and I'm sure in the EU and UK, I'm sure basically it's the same thing, because I'm sure like in London, in Paris and in Berlin, there are many hospitals that have these super cold refrigerators, and basically they can put them in and stuff. But when you get out, when you get outside the main cities, it's like Wisconsin. When you get outside of southeastern Wisconsin, even into what's called southern Wisconsin, where Madison and Wisconsin Rapids are, or northern Wisconsin, you're actually getting into a part of Wisconsin where it's different than what most people from other parts of the U.S. would think, or like people from New York would think, or people even from European states would think. Because in southeastern Wisconsin is part of the Milwaukee-Chicago metro city, which is something that's mentioned by Richard Florida in his book, Who's Your City, as well as Flight of the Creative Class. And being a metro city, I mean, we have a population of about, I think, 9 million now, like that. But the thing is, we still have our big city areas, which are very congested, in our country areas, like we've seen. But the thing is, we have public transportation. So, like basically Chicago, the northern suburban cities of Chicago, we see in Kenosha, Milwaukee, up to Sheboygan, have public transportation as well as interstate transportation, as Waukesha, Brookfield, Walter, and so it's a connected system. So basically, if you want to go from the south side of Chicago all the way up to Sheboygan, you could by public transportation, or south side of Chicago all the way out to Waukesha, you could. But when you get to southern Wisconsin, which is like this, or northern Wisconsin, which is sort of like that, you need a car or a good truck, but both of them have to be in good repair, because basically that's where the cities become 5,000 in population. Many of them don't have a bus service, and so you either have to have a car, have someone drive around, and if you need to do anything major, you have to be prepared to drive 50 miles or at least an hour. So, and this is the point about this vaccine. When we do get it, that's the thing about the logistics, because basically there are many states in the United States that are like Wisconsin. You have you have a major metropolitan area, and then you sort of have a semi-metropolitan area like southeastern Wisconsin. Then you have country, and how do you do it? And the thing is though, with the vaccine though, it's a case where I saw news like where England has to shut down, and also Berlin has to shut down. England had the vaccine, earlier, and I'm surprised England had to shut down so drastically, because I thought more doses would be distributed so that they could try to slow it down a little bit. But I guess I'm seeing with the logistics of trying to inoculate everyone from the vaccine, de-chilling and getting it ready and everything else is more. Everyone's learning for the first time. So and that's part of the learning curve. But we really need to, if we're going to really inform people, the thing is to keep spirits up, and also not. The reason why people sometimes call news fake news is because they're tired of the cheerleading of newscasters saying, well, that are certain for political parties saying, oh, this party's doing great, this party's doing great, when really there's some things that they really need to tell the people that that's not, or another party doing this same thing. And I'm not saying basically don't be completely dour, but I'm saying, look, be factual. It's like in golf. When you're in the rough, you pull off the 7-iron. When you're in the fairway, you can pull out a wedge and get it closer. But be true. But be true to the news you're giving people. And also, regardless of what this political campaign in the U.S. It's the election's over, and the time of the political jokes on either side of the party, including, should stop. I mean, basically, we really do need to heal, because if we don't heal, and then if we run into delays with this vaccine where we need multiple groups of people work together, it's very hard to get people work together when they can't, when they're still trying to heal. To some people who claim that people who voted Republican were losers, I think one comedy channel really should watch that. In the United States, the presidential election is not a football match. People are voting because they truly believe in a candidate, and whether one candidate is elected or not, it's not whether one wins or loses. In the banana republic, there are losers because basically the losers are punished. But in the United States, we're not a banana republic yet. So, I mean, to the comedy people in New York, I would really strongly suggest don't use the word losers when identifying Republicans, because I'm a social compassionate Republican, and I believe in healthcare, and I believe in certain things. However, the issue comes again is, how do we do it? And I still believe sometimes it's better to do a pilot program and then get something started, and then basically that we can build onto. Because when you try to start something too big, it'll crash. Like when I develop my programs, I start with a few. I draw the screen. I start with a few simple modules, and then what happens? Through continuous refinement, I add on to it. But as I'm doing the continuous refinement, I know that the previous blocks work, so I don't have to worry about building a house of cards. And that's what my point is. We want to do stuff, but we don't want to make it like a house of cards. And that's the thing, And sometimes with friends who are Democrats, they say, well, you don't want to do things fast enough. You're acting like an old person or something. No, I'm acting like an engineer. You build a firm foundation. You get plans where you look at the strength of your materials to see just basically what you can do. I mean, for example, even in the United States, basically there's limitations on building a wood frame structure over five stories, and there's a reason for that, because the strength of materials can't handle that. And that's the same thing with social programs. You got to think of it like you're building a house or an apartment building or an office building. And when people don't think that way, that's when I sort of speak up and say, well, wait a minute, let's take a look at the engineering of this. And so, but what happens though to friends in the EU and others who have listened to our broadcast from UW Parks and WIPZ. We thank you for doing that. We don't know what's going to happen with WIPZ. It may not come back, but we'll always have the YouTube. I'm trying to find other radio stations and streaming services to do this and have Nikita, Lon, and Matt back. Right now, based in Wisconsin, people can only meet basically one guest per apartment. So that's part of the reason why you see me doing this most of the time. And Lon, Nikita, and Matt don't have computer resources for us to do like a virtual Zoom thing or virtual, other thing like that. So, and there aren't places in Wisconsin that open where we can do a massive group. There's like McDonald's doesn't have its dining room open, and Wendy's doesn't. Arby's used to, but they had to close it finally because I don't know. The last governor's orders, they finally closed the dining room because they tried complying. They had 25% of it open, which is great for many of us. But I can understand it. Basically, they have to watch the time and the money too. So, and regarding the vaccine, when it does come, I'd be willing. I'm willing to take it, even though I heard the side effects. And but the thing is, what happens though? Whatever happens with the vaccine, please no more cheerleading. And just a thought to some of you. Today, basically, I wasn't feeling well. I was emotionally exhausted because I watched too much in the news. And the reason is because as a former medical researcher, I get frustrated when I do watch the news and see amateur hour things or pathetic things being done. Because in my generation, I still think we were trained better. And I look at it like, oh my God. And when I hear people cheerleading about the vaccine who before basically in March and April were protesting against a certain administration, to me, it's like basically someone claiming they're holding the flag. They're one of 4 people holding the flag at 9/11 when New York was attacked, and they're not. If anyone did that in New York, they'd get more than the fisheye, like that for claiming, false support or false success, and that I won't name names, but basically. So a lot of times I watch YouTube, watch Netflix, watch Comet TV, comettv.com, because they have some nice science fiction programs I have. And also I watch BritBox. I was able to at least subscribe to BritBox and watch 2 episodes of Doctor Who. Let's see. The Happiness Academy and basically Survival, because and I did watch the Doctor Who Comic-Con on BritBox as well. And the thing is, that's what I'm saying is try to watch that you don't watch too much news, because like with me, when I watched too much news yesterday, my brain said, well, let's see what the information, let's see what they're doing, but my body just went tilt, and I was emotionally and physically exhausted. So I'm feeling better now, but to everyone who's listening, I'd like to wish you a Merry Christmas and a Happy New Year. And just remember, basically, we will pull through this, but like Winston Churchill said, the battle's still not over, and we are going to have to remain resolute. So just be that, and finally work together. Whatever your political differences are, whether you're Liberal Party, Conservative Party, across the channel or across the pond, or over here, whether you're Republican or Democrat, we gotta start working together, because this next phase is going to be very hard. It's going to require us to work together, and if we don't, then basically the COVID virus will get more people. So, like Winston Churchill said, never give in, be resolute, but also work together. So, well, let me know what you think. I'm on Twitter at Diana1A, and I just prefer to get email messages that way because it's easier for me. So, again, have a Merry Christmas and a Happy New Year from Ideas with Diana, and this includes Nikita, Lon, and Matt as well.